Thank you for joining us for this important discussion around suicide prevention in the agricultural community. My name is Danielle Day, and I'm a human sciences specialist in the area of family life with Iowa State University Extension and Outreach. I'm going to let our other two presenters go ahead and introduce themselves here before we get started.
Thanks, Danielle. My name is David Brown. I'm the Behavioral Health State Specialist for Iowa State University Extension and Outreach, and thank you for being with us today.
Hi there, my name's Dawn Dunnigan. I'm a Human Sciences Specialist with Iowa State University Extension and Outreach, also in the area of family life.
Thank you to both of you, and thank you to you for joining us. On average, a person dies by suicide every 12.8 minutes in the United States. To put that into perspective, that means while you watch this presentation, we will lose 2 people in the United States to suicide. Given the stress levels in the agricultural community, it's really important that we have more information about what signs of distress to look for and how to help each other. You may have the opportunity to help a friend, a family member, or someone you work with, and we want you to be better prepared to do this. Suicide can have far-reaching impacts on families and communities. We also know this is a difficult topic to cover, so we encourage you to take care of yourself during this presentation. Throughout this presentation, you're going to hear about 2 impactful programs that Iowa State University Extension and Outreach has been offering throughout this past year. The outputs of these programs and the outcomes of these programs. You'll also learn about some risk factors of suicide, warning signs, and review a model that you can use to help someone who may be in distress or suicidal. Resources that can be accessed 24/7 will also be reviewed. The first program we're going to talk about is Question, Persuade, Refer, otherwise known as QPR. This is a 1-hour nationally recognized evidence-based program on suicide prevention. We've been offering it virtually since April, and we continue to do so over the noon hour. The information provided in Question, Persuade, Refer includes information on suicide clues or risk factors, and we cover the 3-step process of question, persuade, refer to engage those who are at risk. This program has been funded by USDA and NIFA, and to register for a program that works in your schedule, you can visit www.extension.iastate.edu/humansciences/QPR. The outputs for this program. We have had 539 participants attend 35 programs between April and August. We continue to have participants attend programs once a week. We've had participants from over 14 states and 2 Canadian territories, and a wide representation of entities as our participants. We've had participants from the USDA, commodity groups, farm credit services, local banks, state departments of agriculture, public health. Our cooperatives have been represented, as well as those in our vet industry, state extension services from various states, human service entities, and several other entities have all been represented. Some of the outcomes for this program. We provide a pre-survey prior to the program, as well as a post-survey. And the results display very positive trends in increasing knowledge about how to ask someone about suicide, persuade someone to get help, and how to get help for someone. As you can see here, when it comes to asking somebody about suicide, people have increased their knowledge by about 70.73%. The knowledge and comfort level of persuading someone to get help is at 54.7%. And the ability to and knowledge on how to get help for someone is almost at 71% increased. I'm going to now turn it over to Dawn to talk about our other program and cover some warning signs and risk factors of suicide.
Thank you, Danielle. Stress on the Farm, Strategies to Help Each Other is a 40-minute program on suicide prevention. The program includes information on the warning signs of suicide and risk and protective factors. It is scenario-based, and it was funded by the Great Plains Center for Agricultural Safety and Health. Some of the outputs for this program include it was offered at 95 Farm Bill meetings from November 2019 through February 2020. It was a collaborative effort between Iowa State University Extension and Outreach Human Sciences Specialists in Family Life, A&R Extension Farm Management Specialists, and Farm Service Agency County Directors. There were 4,376 participants. Immediate results displayed positive trends in increased knowledge, willingness to engage, ability to communicate, and awareness of resources. There was no significant findings of difference between the initial and 3-month responses that participants gave. This indicates that the knowledge, willingness to engage, ability to communicate, and awareness of resources was likely maintained after a 3-month time period. Again, the sample size only included a small portion of our participants who completed both the pre and the post-test surveys. Let's talk a little bit about risk factors. Here are some factors that are often associated with someone being suicidal that were reviewed in the program. Age and gender. Men are more likely to die by suicide than women, though women make more suicide attempts. Older adults and adolescents are most at risk for suicide. People who are depressed are more prone to suicide. Individuals with anxiety are also more likely to die by suicide at a lesser extent. It's important to know that persons using alcohol and drugs can have impaired judgment and are much more impulsive. Heavy alcohol users are 5 times more likely to die by suicide. Alcohol has been found in the blood of 29% of Americans who die by suicide. Unwillingness to seek help and difficulty finding help are risk factors. Losses that could include relationship breakups, death, financial losses or farm losses, risk factors. Physical illness are associated with an increased risk of suicide, and those could include back pain, sleep disorder, coronary heart disease, stroke, traumatic brain injury, and chronic obstructive pulmonary disease, and others. 2 factors believed to pose the most significant risk are having made a previous suicide attempt and having an organized plan with access to lethal means. Warning signs, when to become concerned. Individuals often express warning signs before attempting suicide. One of those warning signs could be a comment, a message, a profile, or some kind of a post on Facebook or social media about suicide or talking about death. Maybe the person angrily voices about getting even with another family member, banker, or lender. You might notice a person to be drinking a lot more and talking about other substance use. The individual may report feeling hopeless or that he or she has no other options. A dramatic change in mood. This could also be a positive dramatic change. I'm feeling so much better. We need to remember this might not be a good sign, since the person may have resolved to take his or her life and now has a sense of peace and resolution. More warning signs on when to become concerned. Making a statement such as, "I have no reason to live," is a major concern. Having a sense of purpose in life or a reason to live helps us to cope with difficult situations and brings a sense of well-being. So we need to pay close attention for such verbalization. Another warning sign or concern could be when an individual starts giving away cherished possessions and items. The individual might talk about shooting him or herself or others. Or maybe they say, "I wish I could go to sleep and not wake up." Both statements need to be taken seriously. If the person starts searching for lethal means such as firearms or medication, he or she may be organizing a plan to kill themselves, and this is a very dangerous sign. I'm going to turn it over to David, where he's going to talk to us about some steps.
Thank you so much, Don. What we're going to do now is we're going to review the CORN model. And this model was developed to assist participants to engage and intervene with those that they may be concerned about. And so I'm just going to quickly review this model. The first step is choosing to engage. Now, I put that in first because foremost, certainly to help someone else, you have to choose to engage them, and sometimes we don't choose to do that simply because maybe we're uncomfortable doing it. Maybe we don't want to embarrass the other person, or maybe we just don't know how. And so that is probably the most important step, is that we choose to engage someone that we know who may be distressed. The next step is offering support, listening to the person closely and using active listening. And we certainly want you to respectfully ask, are you thinking about killing yourself? Now, that's important because many times we don't ask that question, or we're afraid to ask that question because we're not sure about the response. There's also a myth out there that says that asking that question could prompt a suicide attempt. Well, we do want to make sure you know that actually asking that question can actually relieve the person of some of the stress they're experiencing and help them to do some problem solving in the next steps. The next step is refer the person to helplines, lifelines, or local resources. Now, there are many resources available, which are going to review, that are available 24 hours a day, 7 days a week, and certainly a lot of local resources in the communities where you're at. But you have to take that next step and make sure the person is getting help to deal with the situation that are causing them to think about suicide. The final step is N, which is never leave a person alone or without a plan, and never leave a person without hope. If a person is actively suicidal, we never want to leave them alone. We always want to make sure that someone is with them all the time. And that means you have to try to transfer or a warm handoff to someone, could be a friend, family member, or someone's close to that other person, to kind of watch them until they access professional help. And of course, giving individuals hope. We know that hope can prevent suicide. What we're going to do now is we're going to review a scenario that was used to demonstrate the CORN model when we offer these programs at the Farm Bill meetings. I'm going to read the scenario, and then the three of us are going to discuss the following. We're going to talk about signs of stress that we see. We're also going to talk about maybe even some positive factors that maybe help Jimmy in the situation that he is in. And then we're going to do a role play on how to help Jimmy using the corn model that I just reviewed. So let me read the scenario. After finishing college and getting married, Jimmy started farming with his parents. To make it work, he built a new hog barn, and he did pretty well, but then he had to restructure debt to lower his payments. Now the contractor wants new feeders, waters, and ventilation in the hog barn. Jimmy also started a seed business that has done pretty well for him. His wife begged him to get rid of the hogs and row crops and just sell seed. He knows that once he pays for the row crop losses, the machinery payments, that there's not much left. And if he has to borrow more to renovate the hog barn, that will cut profits from the seed business. He can't decide what to do. And his wife just told Jimmy that she does not want to be married to a hog farmer anymore. Jimmy has been drinking and stops by your house. He says he doesn't know what to do anymore, so he just drinks. So Don and Danielle, I'm going to ask, what type of concerns are you seeing with Jimmy at this point? What are some factors that might make you a little worried about?
I see losses. I see he's looking at losses of finances, of the farm, and relationship loss, possibly with his wife.
Yeah, so those are very big factors that would put him a little bit more at risk. Any other concerns that we see here?
He's having difficulty making decisions, not sure what to do, and he's increased his drinking a lot to cope with everything going on.
Yeah, and that's certainly a maladaptive coping strategy. They're trying to help him, trying to avoid the stress and kind of forget about the stress. Certainly, that would be a concern that we need to pay attention to. The drinking also impacts his ability to make good decisions. So that's a key factor. Now let's look at the other side. What are some positive factors that you're seeing here with Jimmy?
You know,
Oh,
I see that he has some relationships. He has friends and he has parents. So he does have some positive relationships that are active.
Exactly. And that can make such a strong difference if we have some social contacts to kind of help us problem solve difficulties like this.
He does have some financial opportunities there. The seed business is doing well. So there are some options available.
Yeah, so maybe we can get someone in to help him kind of look at his operation and maybe make some better decisions of what he needs to do to kind of get back in the profit category again. Again, thanks Don and Danielle for that information. We're going to move now on to doing a role play regarding the Cole model. One facilitator, myself, will play the role of one who's troubled, which is Jimmy, of course. And so I'm going to be talking to a very close friend, Don, who is concerned about me. Again, Don will play the role of the concerned friend. Don is going to choose to engage me, offer support, ask the suicide question, and she's going to refer me to a local resource or lifeline. And she's also going to make sure that I am not left alone. So again, let's go ahead and proceed with the role play.
Hey, Jimmy, I'm concerned about what you just said, and I want to make sure you're okay. Do you want to talk about it?
Yeah, I can do that.
You said you don't know what to do, and I know you've been drinking more since your wife said that she wanted out of the relationship. Those things really got my attention, and I know that's a lot for anyone to bear. I also know that farming has been tough for a lot of folks lately.
And you're right, it's really stressful, and the livestock business is rough right now, and I just can't seem to get ahead no matter what I do. And now my wife wants to leave.
No, that's a lot. Doing everything you can and things still not going the way you want. You seemed pretty upset tonight when you got here.
And I just can't quit thinking about my wife and my businesses and just what I'm going to do.
It's tough right now, and things they just sometimes seem to overwhelm us. Jimmy, I have a question I need to ask though. I know it may sound funny, but I really need to ask. Have you had thoughts of killing yourself?
Whoa, I mean, that's pretty direct, but yeah, it has crossed my mind. Just doesn't seem like there's many reasons to stick around.
Okay, this sounds pretty serious. Have you thought about how you might kill yourself?
Um, Not really, but I do have a few guns around the house.
Thanks for letting me know that. I'd like to help if I can. Could we go together right now to the hospital and we can talk to somebody? Or maybe I can, take you to the pastor or call the pastor and he could come talk with us tonight.
I really don't want to go to the hospital, and I don't know that pastor very well.
Well, we need to figure something out. How about we call the National Suicide Prevention Lifeline together? I can call and then you can talk.
Sure, that might help. Do you have the number?
I do. Last week I saw the number and I put it on my speed dial. I heard that it was a really great resource.
So Jimmy has just finished his call with the Lifeline, and he's getting back to Don here. Hey, Don, the person on the Lifeline was really helpful. They gave me the phone number of a local mental health provider to call first thing tomorrow, and I guess they offer emergency appointments.
That's great. There's a few things though I want to touch on. First, I think you should stay here tonight because you've been drinking. And we have a nice spare room. I also want to call your parents and kind of let them know what's going on. Could we go together tomorrow to your house and put trigger locks on the guns? Also, will you promise me to stay here in the morning and then I can take you to your meeting in the morning with the counselor? Finally, can I call you a few times this week just to see how things are going?
Yeah, that's all fine. My parents are going to freak though.
No, they might, Jimmy, but it's important to get more people involved.
Yeah, I suppose. Thanks for helping me out tonight.
Just want to make sure that you know I'm on your side and I want to help see you through this.
Yeah, that would be okay. Yeah, thanks for your help tonight. Could you show me the spare room? Thanks very much, Don. What I do want to say is that role play went pretty quickly. It went pretty smoothly. We do know that sometimes it won't go that well. You may have to be a little bit more persistent. The individual may become a little bit more belligerent. And certainly if he's been drinking and he leaves the house, you may need to call 911. But we need to make sure that you and this person is safe. And so we went through all of the steps. Dawn chose to engage me. She offered support and referral. She asked the tough suicide question. She referred me to the National Suicide Prevention Lifeline, and she made sure that she was with me or someone was with me until I got professional assistance. And so that was kind of a great example for us to use the CORN model. So we're glad you could listen to that. Again, we have options to access all the programs we talked about. We'd love you to go to the Extension Farm and Ranch Wellbeing site at https://www.extension.iastate.edu/human sciences-farm and ranch wellbeing. That's the place we can automatically go to the QPR programs as well. Again, I just want to quickly review some of the great resources available in the state of Iowa. Certainly, I need to mention the Iowa Concern Hotline at 1-800-447-1985. It's a hotline that's available 24 hours a day, 7 days a week. It's confidential, it's free. Persons on the hotline can provide short-term stress counseling as well as resource and referral to any county in Iowa. Also, if individuals are in crisis, the National Suicide Prevention Lifeline is 1-800-273-8255. Again, available 24 hours a day, 7 days a week. It's free and confidential and actually answered in Iowa. Two other resources to be available are the Veterans Crisis Line at 1-800-273-8255 and press 1. And the crisis text line is text home at 741-741, because we know some individuals are more comfortable texting than talking with some on the phone. Great resources to be aware of. Again, we want to thank you to joining our presentation today on suicide prevention in the agriculture community. If you have any contact questions or would like to contact any of our other presenters, feel free to do that. We're also available for any type of other presentations. And so we thank you for, again, being with us today for this presentation.